Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson, and today we're going to talk about small breed dogs under anaesthetic and for neutering. So the main issue here being the anaesthetic. So anaesthetics are obviously pretty routinely given, always for neutering, and generally there are very few problems with them. But it's important to understand that an anaesthetic essentially is a controlled poisoning of the brain, which is allowing us to perform procedures that we wouldn't otherwise in a conscious animal be able to do, and enables us to provide plenty of pain relief, so obviously they're not feeling anything of what we're doing. And I say controlled because it is. We're giving a dose that we know is as safe as it can be, and is going to have a time limited effect and not going to have lasting effects on them. Now, we're talking specifically small breed dogs, and that's because there are some specific issues with really small dogs. The main issue would be around hypothermia, so that's getting too cold. This is particularly a risk for toy breeds, so the likes of your Chihuahuas and so on, that are very small, don't tend to have a lot of muscle to them, but ultimately still have quite a lot of surface area, so they don't have the ability to generate their own warmth. And obviously when you're under anaesthetic, you don't feel like you're getting cold, so you can't shiver, which is the normal response to getting cold. So the big issue there with getting cold is it can then compromise your immune system's ability to function, but also actually your cardiac system's ability to function. And so staying warm, really important while you're under anaesthetic. So making sure obviously that your vet has got things in place like heat pads under the surgery table. For things like neutering, is there a possibility they can wear a jacket or have booties, or using things like bubble wrap on their feet, potentially their ears. There are some fantastic products out there called bear huggers and so on that are essentially heated beds that they lie on for surgery. So those are sort of things that can be done to keep them warm during surgery, but also after surgery, making sure that they've got some form of heat provided that's safe for them when they're not able to move away from it that easily, but is going to be enough to provide them with heat to prevent them getting cold and losing heat themselves. The other issue with small breed dogs is often they're much more prone to hypoglycemia, so low blood sugar. When it comes to anaesthetics, it's always safest to give an anaesthetic on an empty stomach, but it's worth talking to your vet over what length of time is going to be suitable to withhold food from them prior to surgery. So pretty routinely we tell people to take food away when you go to bed at night and don't give them breakfast in the morning. For some small breeds of dog that are high risk, it may actually be worth giving them a small feed in the morning before they come in to make sure we reduce the risk of that hypoglycemia. I should say this also actually applies to very young patients who are going to be anaesthetised, and also older patients who obviously are potentially quite skinny or have got other concurrent conditions that are going to reduce their ability to react as a normal healthy animal might. The other issue, I guess quite commonly, our brachycephalic breeds are quite little, so the likes of our French bulldogs, pugs, Boston terriers and so on. So this is the dogs that have the very short noses, squashed in faces and so on. So they have some issues with breathing that tend to be exacerbated when they're under anaesthetic, so they're no longer in control of their own airways. We put a tube down their throat, but usually what happens prior to an anaesthetic is they get a pre-medication. So this is causing them to be a wee bit sedated, and it's usually the pain relief going on board as well. Sometimes that sedation's enough in those brachycephalic breeds that actually they can't breathe properly anymore. So there's a different regime given to them, and often there's some medications that are given prior to them even coming into the veterinary clinic for the procedure to try and reduce some of the side effects that come with that obstructive breathing, basically. So we've talked about lack of weight and so on, but also unfortunately for small breeds of dog, they're often prone to getting very overweight, and that also has issues under anaesthetic. So particularly for a procedure like neutering, which is, it's it's not an emergency procedure, so we will often recommend that they lose some weight before they come in, because it massively reduces the anaesthetic risk, particularly the pressure on their airways. If you're talking an abdomen full of fat, that's a lot of pressure on the diaphragm, makes it a lot harder to breathe. But also their metabolism of drugs can be quite different when they're overweight. They can be a lot slower to metabolise them, which can have influences after they've recovered or appeared to have recovered from anaesthetic as well. So if you've got any concerns, if you've got a small breed of dog that potentially is quite skinny, prone to not coping very well without regular feeds, or potentially obese, make sure you talk to your vet and get a proper understanding of how you best to feed them prior to an anaesthetic. Is there anything you can provide to help keep them warm during and after an anaesthetic? Is there anything you can do to help them either gain or lose weight prior to coming in for the anaesthetic? Because like I say, if we're talking neutering here, this is a procedure that isn't required to be done in an emergency.